Well, let's get more analysis on this now with Anumita Roychowdhury, who joins us from New Delhi. She's the Executive Director at the Centre for Science and Environment. Really good to have you with us. Thank you for joining us on TRT World. We know that we've been keeping a very close eye during this pandemic on the number of cases and the death toll in particular. Over the course of the last 2 years or so, the World Health Organization says around 6 million people have died from COVID-19. But this Lancet report says that 9 million people died in 2019 alone from pollution. That's something that's been underreported and really the world has largely ignored. Explain to us why that number is so big.
Very true. And it's what is very worrying about the fact that what the Lancet study is telling us, that globally, total deaths from all causes have been 9 million. Out of that, 6 million due to only air pollution-related diseases. And that is 74% of the total deaths due to air pollution. And that's the scary part of it. And also the more granular information that is available, it shows that most of the deaths are also happening in the poorer part of the world. In Africa, in Asia, in South Asia, with the parts which are now developing, growing economically, industrializing and motorizing. Clearly what it shows is that because we are not being able to invest enough in pollution control while growing, and that is increasing the toxic risk for us. But the bigger message is that air pollution related deaths are avoidable. These deaths don't have to occur if we act on time and we take the right decisions to adopt the clean technology, clean fuel, also ensure that our dependence on personal vehicles not increasing. We are able to manage our waste better, recycle the waste and not burn the waste. And when we are constructing, the construction industry is not contributing to pollution. But for that, we need to set the right terms of development. The fact what the new study is showing, that the deaths are also chipping away our GDP, which means the economic growth is coming to us at an enormous price. People are dying and falling ill because of that economic growth. But it need not be so. We can avoid this if we can grow sensibly. And in developing countries like Africa, in Asia, we have a chance to grow differently. Because even though we are poor, but because the growth is yet to happen in Africa, so if the terms of that economic development can be different, if we can bring the right investment to move away from fossil fuel and promote a clean energy. At the same time, the advantage of our baseline is both in Africa and Asia, majority people are still walking, cycling, using public transport. It is a huge opportunity. So if we invest in them, the solutions that we are part of, then we can prevent the increase in pollution in the future. And that's what we need to So the very interesting study that the Lancet study that has shown is the double burden in Africa and in Asia. Because we are poor, therefore the traditional health risk associated with water pollution and household pollution, because we burn dirty fuel inside our houses, that risk is slowly coming down as we are growing economically.
Okay.
But
Anumita, I'm so sorry to interrupt. We are running out of time. But can I just ask you, in terms of a solution for the problem, what, in your mind, would be the best way to tackle the growing pollution in areas like Africa right now? If you could come up with one solution, what would that be?
I think the biggest solution will come from the energy choice. That if we can push our fuels to improve and we adopt better technology, promote renewable energy, and in the vehicle sector, if we can control import of old used vehicles and instead of that adopt cleaner technology, electrification, then these are some of the very important solutions that we can roll out in Africa. But of course, this will have to be supported, enabled, so that the cost of transition is also affordable for most of us. That is the most critical way to move forward.
Okay, Anumita Roychowdhury, we will have to leave it there, but really good to get that analysis. We appreciate your time. Thank you.